A bit of the jigsaw that I think is still missing, particularly in the NHS, is involving patients. I do speeches to MPs, captains of industry, all sorts of people. They don't raise concerns. They very rarely read their notes. They don't like challenging authority. You know, they'll do that, be really ballsy in their business lives, but as soon as they're faced with a doctor, they regress to almost this childlike dependence, and we absolutely fundamentally have to change that. I have this view of the NHS is that patients and relatives and frontline staff should be like a smoke alarm for what goes on. You know, if you can pick up, and there's no reason now we can't. We've all got all sorts of electronic gadgets for capturing feedback in real time. But if you pick something up on a ward and people are encouraged to feedback, you pretty soon find out where your hotspots are. You know, if you're in hospital and someone tries to give you a long blue tablet when you normally have a short white one, you should say, excuse me, I normally have the short white one, not the long blue one. Most people won't. They'll just sit there. If the drip goes in over 4 hours one time and 2 hours over the next time, most people will just let it go. You should ask. Number of people you can, you know, every day people observe staff not washing their hands and don't question it. I'm actually a vice president of the Patients Association, and we've come up with these T-shirts to wear in bed that say, don't touch me unless you've washed your hands. You can wear them out clubbing as well, actually. They're, the T-shirt I want to try, I'm in the pilot stage of this. I want a T-shirt with, please try not to kill me today. I've tried it in my local hospital. It's really interesting, actually, because people they find, actually, you get a lot of attention then. They kill the person in the next bed, but they absolutely focus on you. And I think there are ways of using humour constructively within healthcare settings that actually make a big difference from both of us. You know, I did this very heavy talk recently with a lot of the nursing organisations about mid-staffs and how we're going to move on. And it got really, really heavy. And then this lovely sister said, does anyone play We with the patients, the We Fit game? She was working in elderly care, and she'd get We Fit games and all these games out, and they'd have games, and they'd have fun. And that, again, is a really good signifier of a healthy culture, where you're getting the patients out, you're playing games with them, you're smiling, you're laughing. And again, I sense that if we keep beating ourselves up about the bad stuff, we'll forget how to have fun in healthcare. So I think it's fundamental that we should all be interactive, but we should be listening to patients. Nearly always, patient feedback you get is brilliant, it's worth having. And the one useful bit of the Health and Social Care Bill, actually I agree with, there's something called the Outcomes Framework. For the first time, and I'm sure they're doing this in Wales as well, they're actually measuring patient experience as a key one of their outcome measures. So in England, they have 5. They have stopping people getting sick, which is a good idea, helping them recover from acute illness, obviously a good idea, managing chronic diseases better, absolutely vital, because that's where about 80% of the budget goes, measuring patient experience and improving patient safety. 5 actually really important outcomes. But patient experience is a new one. You're actually going to ask people, have we actually made you better from our care? And it's really scary, because I bet if you do it, you're going to find 30, 40, 50% of patients say, I haven't noticed much difference. We spend an absolute fortune on them, and you say, well, actually, did we make it easy for you to get up the stairs, play with your kids, have sex on a Sunday afternoon? A lot of them will say, well, no, not really. And that's really, we've never done that before. We've just measured ourselves by process and activity. We've never really measured ourselves by outcomes. So we need fine ways of measuring outcomes. So there are patient-reported outcomes, and the really sexy bit is something called patient-determined outcomes. So the patient says, I have diabetes, I'm going to go to rugby on a Saturday, I'm going to drink too much on a Saturday night, I might have the odd fag, I want to have sex, this and this and this, I want to go on a holiday, blah, blah, blah. Can you help me? And that's really interesting. It's then the patients with a chronic disease defining what they want you to do for them. Patient-determined outcomes is the sort of the direction we're moving in.